7 common medications that can harm your kidneys. We all know that medications help us manage our health, but did you know they can sometimes be harmful to our kidneys? As we get older, our kidneys don't work as well, and the medicines we take can make things worse. This is a big deal because aging usually means more health issues and more pills. Some medications are tough on our kidneys, either directly or indirectly. This can lead to a range of problems, from reduced kidney function to serious health issues. The risk is even higher if you're older or already have kidney problems. In this video, we'll talk about common medications that can harm your kidneys and give you tips on how to manage them safely. Stick with us until the end. You'll get valuable information that can help you protect your kidneys and stay healthy. You won't want to miss this. 7. Antibiotics. Antibiotics, vital in combating bacterial infections, are diverse in their mechanisms and impact on health. Commonly prescribed antibiotics such as Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin are effective against ailments like strep throat and UTIs, yet they remain powerless against viral illnesses like the common cold or flu. While antibiotics are potent tools, their misuse or overuse poses significant risks. Beyond causing common side effects such as diarrhea and liver issues, some antibiotics like polymyxins and aminoglycosides can inflict direct harm on kidney cells or disrupt kidney tubules. This can lead to serious kidney damage, necessitating cautious administration and adherence to prescribed regimens. Moreover, the development of antibiotic resistance underscores the importance of prudent antibiotic use. Overprescription or premature discontinuation of antibiotics can foster resistant bacteria strains, complicating future treatment options. Health professionals play a pivotal role in selecting the appropriate antibiotic and monitoring kidney function during treatment, particularly when nephrotoxic antibiotics are involved. Patients also bear responsibility in antibiotic stewardship. Completing the full course of antibiotics as prescribed, even if symptoms abate, is crucial to ensuring complete eradication of bacterial infections and minimizing the risk of complications, including kidney damage. By fostering awareness of these nuances and emphasizing responsible antibiotic practices, we can safeguard both individual health and the broader efficacy of antibiotic therapies for future generations. 6. Nonsteroidal anti-inflammatory drugs, NSAIDs. Ever reached for ibuprofen or aspirin to ease a headache or joint pain? You're not alone. NSAIDs like these are go-tos for pain relief and fighting inflammation. They work by putting a stop to the COX enzyme, which not only helps dial down pain but also keeps your kidneys safe and sound. But here's the twist: NSAIDs can sometimes throw a wrench into the works for your kidneys. They can crimp blood flow to these vital organs and cause your body to hold onto more fluid, which can spell trouble. In some cases, this can lead to acute kidney injury, AKI, or even set the stage for chronic kidney disease, CKD, if you're not careful. Think of it like this: a little ibuprofen here and there isn't usually a big deal, but crank up the dose or use it day after day, and you might be flirting with trouble. It's all about balance and knowing when to reach for these meds and when to explore other options, especially if you've got kidney concerns already. Doctors keep tabs on this stuff, watching out for signs of kidney issues when NSAIDs are in play. Remember, they're there to guide you on the right path to pain relief while keeping your kidneys cruising along smoothly. 5. Diuretics. Ever felt like you're retaining more water than a sponge? That's where diuretics come in handy. These medications are like your body's plumbing team, helping manage conditions like bloating and high blood pressure by dialing up the urine output. You might have heard of hydrochlorothiazide, bumetanide, furosemide, spironolactone, or acetazolamide. These are some of the heavy hitters in the diuretic world. They do a great job of flushing out excess fluid, but like any hero, they have their quirks. Using diuretics can sometimes throw off your body's water and electrolyte balance, which can put your kidneys on edge. Imagine a garden hose that's a bit too enthusiastic. You're getting rid of water, but you might also lose essential electrolytes along the way. That's why it's crucial to keep an eye on your kidney function and make sure you're sipping enough water throughout the day. Dehydration isn't just about feeling parched, it can mess with your kidneys if you're not careful. Doctors often keep tabs on things, monitoring your kidney function and electrolyte levels when diuretics are in play. Remember, it's all about finding that sweet spot where your body feels balanced and your kidneys keep humming along happily. Most importantly, you're still here with us and may have overlooked subscribing. If you find this video beneficial and recognize the effort being put into it, we would appreciate seeing your opinion in the comments. Don't forget to subscribe to our channel and feel free to return to continue engaging with us. 4. Proton pump inhibitors, PPIs. Got heartburn? Proton pump inhibitors, PPIs, are like the superheroes of acid reflux and GERD. They swoop in and dial down your stomach's acid production. You might have heard of omeprazole or esomeprazole, two of the heavyweights in this league. But like any superhero, PPIs have a few weaknesses, especially if they stick around for the long haul. They've been known to stir up trouble in the kidneys, potentially leading to acute interstitial nephritis. That's a mouthful, but it basically means inflammation in the kidney tissues, and even chipping away at kidney function over time. Here's the kicker, PPIs can also mess with your magnesium levels. Low magnesium, hypomagnesemia, might not sound like a big deal, but it can actually set off a chain reaction that leads to kidney issues down the road. Doctors keep a close watch on things when you're on PPIs, checking in on your kidney function and making sure your magnesium levels are in a safe zone. It's all about finding that balance, managing your acid reflux while keeping your kidneys happy and healthy. 3. ACE inhibitors. Let's talk about ACE inhibitors. These are like the peacekeepers of your blood vessels, keeping blood pressure in check and helping out with heart and kidney issues. You might know them by names like lisinopril or enalapril. Here's the deal, ACE inhibitors do a great job at relaxing those blood vessels, which can really help your kidneys get the blood flow they need to stay healthy. But, like all good things, there can be a downside. They have this tricky little habit of sometimes decreasing something called eGFR, which stands for estimated glomerular filtration rate. That's basically a measure of how well your kidneys are filtering waste out of your blood. For some folks, especially those with existing heart problems or who might be a bit dehydrated, ACE inhibitors could throw a curveball and lead to acute renal failure, a sudden drop in kidney function that needs serious attention. That's why doctors keep a close eye on things when you're on these meds. They'll check in regularly to make sure your kidneys are handling it okay and adjust your dosage if needed. It's all about finding that sweet spot where your blood pressure stays in line, your heart is happy, and your kidneys can keep doing their job without any hiccups. 2. Antiviral drugs. Let's dive into antiviral drugs. They're like the superheroes fighting off those serious viral infections. Names you might recognize are remdesivir and acyclovir. Now, here's the thing. While these drugs are lifesavers against viruses, they can also stir up trouble for your kidneys. Sometimes they cause direct toxicity to those kidney cells, or they might even create little crystal formations that can lead to kidney stones. In severe cases, they can cause acute tubular necrosis, which is a serious condition where the kidney tubules stop working properly. If you already have kidney issues, these drugs need extra attention. Doctors will keep a close watch to make sure your kidneys are handling the treatment okay. And it's super important to stick to the prescribed dose and schedule. Using these drugs consistently and correctly helps prevent not only resistance to the treatment but also any extra stress on your kidneys. So, while antiviral drugs are fantastic at knocking out viruses, keeping an eye on your kidney health is crucial to ensure everything stays balanced and healthy. 1. Lithium. Let's talk about lithium. It's a crucial medication for stabilizing moods, especially in conditions like bipolar disorder. Now, here's the catch. While lithium can work wonders for mood swings, especially over the long term, it can also throw a curveball at your kidneys. Some people might develop nephrogenic diabetes insipidus, which messes with your body's water balance, or in really rare cases, it could even lead to end-stage renal disease, ESRD. That's serious stuff. If you're taking lithium, keep an eye out for signs like peeing a lot, feeling super thirsty, or getting dehydrated more often. Those could be signs that your kidneys are feeling the strain. To keep things in check, doctors will monitor your kidney function regularly and tweak your dosage as needed. It's all about finding that balance, getting the benefits of lithium without risking harm to your kidneys. So, while lithium is a lifeline for managing mood disorders, staying vigilant about kidney health is key to ensuring your treatment remains effective and safe in the long run. Understanding the risks of these medications empowers you to safeguard your kidney health. Ensure the right dosage, annual blood tests for creatinine, and prompt medical attention if anything feels off. Lithium, for instance, can impact not just kidneys but overall health. Share any existing conditions with your doctor before starting. If you suspect meds are affecting your kidneys, seek help promptly. Kidney failure signs like decreased urine, swelling, or fatigue should never be ignored. Regular tests, creatinine levels, GFR, and urine protein are vital for monitoring. Stay hydrated, eat well, exercise. These steps protect kidneys from harm. For more on health insights, subscribe and hit the bell for updates.